September is Suicide Prevention Awareness Month, and next week specifically is National Suicide Prevention Week.
This annual campaign across the country is to inform and engage health professionals and the public about suicide prevention and the warning signs.
Joining us today is Ian Perry, a longtime volunteer with the American Foundation for Suicide Prevention, who also serves on the organization's National Public Policy Council. Ian, thanks so much for joining us today.
Oh, thanks for having me today. It's great to be here.
Ian, the CDC reported recently suicides reached an all-time high last year in 2022. How important is this effort, especially right now?
Well, it's been important, and it's been an important conversation really on a national level for a number of years now. And although there's a provisional data that was supplied by the CDC, that data is incomplete and has not been fully vetted. So, you know, we are referring back to the 2021 data, and we have seen some spikes in certain populations for sure, and we've seen some decreases in other populations. So, you know, we want to make sure that we have a complete holistic picture of the data that's been provided by the CDC once the full report's been put out there.
So of course we can't generalize too much, but what can we point to that might lead to some of these increases?
Well, you know, suicide's a complex issue. It's a health issue, and you know, we don't really think of it that way, but we do a really good job in America of taking care of our health from the neck below.
Sure.
But from the neck above, it's not been really talked about a lot, right? So. We've done a lot to reduce the stigma of speaking about mental health. We find it to be a signal of strength when you reach out for help, specifically, you know, through your community and religious. Certain religions will be open to having these conversations, and you know, being connected to a community. All of those things really are protective factors that allow somebody to be open about the things that they're going through.
If someone's going through a rough time at home and watching this, what is your advice to them, and what are some warning signs family members and loved ones can see to say, okay, we have to address this?
Sure. So, you know, we say that there's three things that you should be looking for. It's talk, mood, and behavior. So you want to watch what people are saying, whether they're joking about it, or they're being serious about saying, you know, I'd be better off if I wasn't around, or they're not engaged in the things that they love. You see people that depression's linked to suicide. It's probably the #1 mental health condition that's either being treated or not being treated. And when that occurs, there are other mental health conditions, obviously, that are out there that are more serious that also can help, you know, put somebody into a moment of crisis. But it's multifactorial. There are environmental concerns that you need to be concerned with, whether that's a job loss, a divorce, a rejection. Those things obviously can play into it, as well as health factors. People that are in chronic pain, people that have a traumatic brain injury if they were a veteran, or you know, had a rollover accident. I mean, these things are all factors that compound, and when somebody goes into a moment of crisis, that's when there are multiple prongs kind of poking at the same time. And those people can't necessarily think clearly. I associate it with having blinders on. They have blinders on, and they're in so much pain that the only way that they see out is to die and to take their life. And those folks need professional help. They need somebody that is going to be open and ask the question, are you thinking about suicide? If they're joking about it, a friend's joking about it, maybe they're dejected at work, maybe they're not engaged, maybe they're having trouble producing, whatever the case may be. People often talk about Joe, who, you know, isn't himself these days, but they're talking to the other coworker about it. They're not talking specifically to Joe about the problem, and having that direct conversation and saying, hey, are you thinking about suicide? Is everything okay? What can I help? What can I do to help you? If you think you're the only person that's gonna take that time to have that conversation and ask the hard question, you need to assume that you're the only one that's gonna do it, instead of talking behind somebody's back.
If someone is in crisis and they don't see a way out, they're not wanting to ask somebody for help, they're not wanting to text 988 or call the hotline, what can you say to that person about why it might be worth it to reach out if they're feeling like those services may not be of much use to them?
Yeah, there's an awful lot of people that have suicidal ideation, and they don't carry out this with the ideation, right? And we say that you're not alone, and you're not. You're not alone. You need to reach out. You need to, the 988 crisis line in Michigan in particular, the infrastructure is built out and it's awesome. 90% of our calls are answered in the state of Michigan by our local crisis hotline folks that work that line. And we are trying to build out our infrastructure for mobile teams that go out that can actually get to the person that's in crisis instead of sending an officer or a first responder to the location, which is a more appropriate use of our and allocation of resources, quite frankly. And the last thing that we're trying to build out with the 988 infrastructure is for a place to go, a safe place to go for somebody that actually needs treatment. I heard a statistic in 1955, there were 355 beds for people that were in mental health crisis. Today, per 100,000 citizens, today there are 17 beds per 100,000 citizens. So it's a dramatic decrease in allocation of funds, and I implore the people that are out here that you speak to your lawmakers and let them know that allocation of funds for FY24 and FY25 to continue to build out of the 988 infrastructure throughout our country. I mean, Michigan is in much better shape than some of the other states, so we're lucky. But we need to continue to build that out, and you need to advocate with your lawmakers to make that happen.
Well, we appreciate your time shedding light on this very difficult subject. Thank you.
Oh, thank you very much. Appreciate
Ian Perry with the American Foundation for Suicide Prevention. Thank you for being here with us tonight.
Thanks, guys.